Okay, good afternoon, everybody. Thank you very much for being here with us for this session of the European Diabetes Forum. I'm Stefano Del Prato. I'm the current president of the forum, together with the vice president of the forum, Professor Chantal Mathieu, who, as you know very well, also is the president of the EASD. What we'd like to do today is just to see which kind of network we are trying to build up between the EUDF and the different countries. And I think that we'll be hearing about some of the experience of the local regions. Now, just to summarize briefly, what is the EUDF? The EUDF is a non-profit organization which is based in Brussels. It's in Brussels because the main objective, the main goal of the forum is to advocate for diabetes. And the center of the political power in Europe is based in Brussels. However, as will become apparent in a moment, this action has to be mediated through the contribution also from the local countries. The EUDF, as I mentioned, is a non-profit organization that's been founded in 2018, and it really encompasses all the top association in terms of research, professional, and advocacy and patients. So you can see here that the EUDF as a member, the EASD, the EFSD, the FEND, the IDF, ISPA, JDRF, BCD, and the Société Francophone du Diabète, and as a supporting collaborator, EPFIA and MedTech. One thing I really like to point out is this: these are members, but all of them are active members. And with active members, I mean, that all of them are contributing with idea, work, effort, suggestion, and so on. So this is a concerted action. It's a concerted action that has another important goal: to convey messages with just a united voice. And since we want to be united, I'd also like to ask all the people that are on the back if they want to come and become united to us. That would be even much better. But anyhow, what we'd like to do is really to have a common voice, an harmonized message that we, as I said, want to convey to the political agenda. And the overall action is that we like to looking for an integrated, honest, and global view. So altogether, just coming up with ideas, coming up and identifying the needs for people with diabetes, and all together with a united voice to move along to convey those messages. Now, the vision and the mission of the EUDF are represented in this slide here. As you can see, the vision, it's something that I think everybody agree on, is that to enable a healthcare system to cope with diabetes pandemic while achieving the best possible outcomes for people with diabetes. And our mission is to ensure the translation of research into policy action toward better diabetes care at the national levels. Many innovations are becoming available. We want those innovations to reach the people with diabetes in a most effective and quick manner. And the EUDF has been moving along with three major initial pillars that are depicted here, which is integrated care, data and registries, and digitalization. This has been, these are groups that have been very active, and documentation has been achieved and made available. And if you are interested, you can go to the website of the EUDF and you can just look at those days. Now, with this brief introduction of the EUDF, I would really like to introduce to you Dr. Bart Torbens, who is the Chief Executive Officer, because I would like to have Bart to introduce all the next speakers. Bart, please.
So thank you, Stefano. Maybe to start with the disclaimer, today we invited 5 countries where we know collaboration is happening, but of course there are many more countries. So next year we can have more countries invited to the stage, and again we of course welcome collaborations and country chapters of EUDF, but in other countries, for instance, like in France, we know there is already a multi-stakeholder collaboration ongoing under another format, and so that's fantastic as well. So today, without going too much in detail, because we want also some time to discuss with the room and with the audience, but today we have amongst us Agostino Consoli, and so very recently I was in Rome like 2 weeks ago. You launched the EUDF Italy, so we will hear more about that and your challenges. As I already alluded to France, Jean-François Gauthier, also board member of EUDF and current president of SFD, will discuss how they work in France within SFD and how they already organized in a multidisciplinary way. And then we will further go on with Romania. Professor Bala, you will report on the Romanian Diabetes Forum, one of the very first chapters of EUDF, and so with already some concrete achievements to present to us also today. So all of you, thanks for coming. And then from my home country, we have Professor Frank Nobles, already working for a few decades on health policy in Belgium, and I guess you will also tell us that you're very happy that it's now a bit more formalized within a structure, within a Belgium forum, and so of course I let you talk also about some achievements and some events that will come on in the coming weeks. And then we will end up with the home country, with Germany. So Professor Galwich, thanks for presenting also the German collaboration, and you're representing DDG today, but also discuss your other functions and your other collaborations you have ongoing within Germany. So, and thereafter, of course, we are very happy to have questions from other countries, suggestions, best practices. So this session is set up also to have some interactive part with Chantal and Stefano. So thanks for coming. And to the speakers, I would say the stage is yours. So Agostino, I invite you.
Good afternoon. Thank you, Bart. Thank you, Chantal and Stefano. As Bart mentioned, the EUDF Italia is a very recent platform of thinking. And we started under the stimulus of the Fondazione Diabete e Ricerca, which is the foundation of the Italian Society of Diabetology, of which I am right now the chair. And we proposed the creation of the EUDF Italia. We start engaging the partner. We submitted the memorandum of understanding to the EUDF. And then in May, during our National Congress, we signed the memorandum of understanding with Professor Del Prato. And after involving all the partners, we had the first official public exit of the EUDF Italia in Rome, September 19, the event Bart was alluding to, where we presented the promo of EUDF. The main partners of course, the two main scientific societies on diabetes, the Italian Society of Diabetology and the Association of Diabetes Physicians, which are together collaborating in a newborn organization which is called FESD, Federation Society of Italian Diabetology, and we have the main partner, also the parliamentary group on obesity and diabetes. Other institutional partners are listed in the slide. I want to underline that among them, there is also another parliamentary group, which is the parliamentary group for the health in the city. As we know very well that diabetes is a common disease, as it is the slogan under which we have the campaign for diabetes for the World Diabetes Day. And one of our partners is the Association of the Italian Township, the ANCI. Besides that, we have about 12 scientific partners, societies with an interest in diabetes, social partners, patient organization, citizen organization, and so on, and corporate partners, which are industries providing drugs or devices for the care of diabetes. Now, what's the Italian scenario right now? We have about 2,000 diabetes endocrinology specialists who are devoted to diabetes, and eventually we have over 600 centers where diabetes care is erogated. However, Of these centers, only 300 centers are the characteristics which I think are necessary for a diabetes center, meaning several physicians and nurses and social assistants and so on working together as a team for the care of the patient. And we also have 90 centers for diabetes care, and the 40,000 primary care physicians who are in Italy, in the territory, need to be involved in an integrated care of diabetes. The impact of diabetes in Italy is more or less the same as in Europe. We have 1 person every 15 versus 1 every 11. It depends on how you make the numbers. But basically, as you know very well, it's a very prevalent disease and a social problem besides an health problem, and economical problem, since 8% of the standing budget, which is still meager in Italy, I believe, is devoted to diabetes. And again, as in several other countries, only a small fraction of this goes out for devices, drugs, or clinics. The bulk of the expenses are still for complications and for hospital stay. What are the critical issues that EUDF Italia trying to face? Inequality. As Stefano was pointing out, there is a difference among the different standard health systems in Europe, but in Italy there is a difference between region to region, which is important because it creates inequality and creates an heterogeneity of the access to the care and to drugs. As we said before, there's too much specialist isolation, and the teamwork is not as diffused as it should be. There's poor integration of care between the specialist and the general practitioner. There's a shortage of staff, which is, I think, is a problem common to many countries right now, especially after the pandemic. The access to data is not that easy, and we have to face several legislation issues in order to be able to use the data for what they're supposed to do, meaning improving our knowledge and improving care. And there also there is an insufficient use of digitalization. Technologies is not as spread as it should be. Based on this, the Italian Society of Diabetology and the Association of Medical Physicians for Diabetes just already in the past year developed a position statement which has been presented in several instances in the Parliament, to the Minister of Health, and so on, which key points are illustrated in the slide, and basically point to diffuse more the idea of the team, so that from this team seen as a hub, then the physician and the nurse get all the move in an organized way on more peripheral points in the territory, but still constituting an integrated care with a network based on digitalization, which sees also the general practitioner in the center together with the patients. Having said that, our political action in Italy has not been fruitless, because we have some of the most advanced legislation on diabetes, starting from the old 115 law in 1987, which established the need for specific diabetes care clinic, to the National Plan on Diabetes Disease, which has been approved by the government, and to the National System of Guidelines, which have been endorsed by the National Institute of Health, which now provide the mainframe for the care of diabetes. But also, we just have a law providing a program for detection of type 1 diabetes and celiac disease in pediatric patients, a law calling for the screening of diabetes. We were discussing this with Chantal before, and I think it's the first example in Europe of a law mandating for such an action. And together, the Senate has approved another law looking at prevention strategies, optimization of cares, and protection of the person in evolving age with diabetes. This was just approved a month ago in September 2023. But also, there are next legislative measures which are in the pot. there is the DDL is a project of law, provision for intervention aimed at introducing physical exercise as a means of prevention and therapy within the National Health Service, provision for the prevention and treatment of obesity, specific law project on obesity, and again a specific law project on the digital therapies and digital therapy toward diabetes are the main portion of this law. Besides, I want to remind you that a few days ago, in the Assembly of the European region, under solicitation from the Italian members, it was approved a motion that poses sport, physical activity and exercise as fundamental tools for well-being, health and social inclusion. And we wish now that prevention of diabetes will be included among the benefit they can derive from practicing of sport, physical activity and exercise. We also have called for a parliamentary pact for diabetes before our latest election, and I think it's very much what it is supposed to do with the EUDF for the political election of the European Parliament. And based on this, we have designed the structure of the EUDF Italia. I am the current chair, relying very much upon the counseling and action and work of Dr. Federico Serra, who is the Executive Director and General Manager. And these are the persons that we have called into the steering committee. We are very fortunate to have among them Stefano Del Prato, who is the present EUDF chairman. We have already established 4 discussion tables on the main EUDF action, on data and register, on integrated care, on self-care technology and digitalization, and also on type 1 diabetes. We understand, especially given the evolution of the program of prevention and therapy of type 1 diabetes, that this will be another topic and focus of action of EUDF. These are the chair of the table, which have presented their ideal project in the September 19 event we had 2 weeks ago, and are now in the process of calling the members of the table and starting to work so that at most in 6 months we will have 4 different policy brief documents on which to launch our action. As final comment, this was the manifest of the EUDF Italia 2023 event, and I'm proud to say that we had 173 media contributions, and from an analysis of the readership, about 7 million people were touched from news about this event, and this, I think, is a good starting point for our next activities. Thank you very much.
Dear Chantal and dear Stefano, dear Bart, and also dear Sylvia, because Sylvia is she's the cornerstone of what we are doing with the French-speaking diabetes society. So my duty here is to show you where we are in France in terms of diabetes cooperation. And I will summarize by that sentence, SFD, which is the Société Francophone du Diabète, French-speaking diabetes society, is the forum for French-speaking country and stakeholder in European Diabetes Forum by itself. So it's just, it's not because I'm the president of the society, but at the moment. But I want to demonstrate that we are, I think that the SFD is in the center of what we are doing in France. So the Société Francophone du Diabète, SFD, has historically inclusion in its mission, statutes,
structure and governance. And that's true that the membership at the European Union Diabetes Forum reinforce a lot the European links. So just to illustrate that SFD present in the 5 continents, and as an example, I would remind you that the SFD was set up by Pierre Lefebvre from Belgium. I think it was 50 years ago, I mean at least more than 40 years ago. So it's, we are present in 5 continents, and this is what makes the strength of this society, especially when we have to deal with the health authorities. So this is how we are organized. This is a very simple organizational chart with the diabetologist, the allied healthcare professional, and also people with diabetes. And we are meeting, I mean, we meet every 4 weeks or 6 weeks. And one of the aim of this executive board is to organize twice a year the board of directors. And this board of directors finally involve all the diabetes organization in France, SFD, of course, people with diabetes, adults, but also children, representative. And we have also representative of diabetologists working in a public hospital, diabetologists working in a private practice. We have also representative from the French-speaking endocrine society, and also some unions, SEDMED and CNP. I will come back later on that aspect. Of course, the foundation is very important in the system, and the foundation, the French-speaking Foundation for Diabetes Research, is very, very linked to this organization. So we have other links. Through its foundation, links are established with the private sector or drug companies to run projects as Coronado and the currently SFT T1 cohort. I put only these 2 projects because this was the 2 projects that federate most French centers. Through it linked and role with the CNP. The CNP is a National Professional Council. It is a grouping of all the components of the specialty, scientific organization, academic structures, unions, and university structures. And the role of the CNP is to define the educational needs in the specialty, but also the CNP is a unique experts and reference for the health authority, including the Ministry of Health, health agencies, which is called Haute Autorité de Santé in France, and also the National Health Insurance, CNAM. What are the challenges? I like the talk from our colleague, Dr. Consoli, because I think that we have the same problem in France because of the lack of relationship with GP organization. And I think this is a matter of concern for the implementation of new drugs and new technologies. Organization of care, initiation and follow-up of treatment, cost under evaluation with an observational study organized by and coordinated by SFD. This study is named OB2F for new technologies, and especially for the initiation of closed loop and implementation of remote monitoring, and you will see that also we have good news on that aspect. We do not have any data registry in France, probably because we have a difficult French data control, CNIL, who say no to everything, almost. But, however, we were able to start, thanks to the previous president of the SFD, Professor Hélène Anner and Charles Tivolet, to set up this nationwide SFDT1 cohort. And I see Jean-Pierre is here, and Jean-Pierre is coordinating this study with Emmanuel Cosson. Some challenges also for access to care. I think we still have some area in France with difficult access to technology and new treatments, and difficult access to some specialists, for example, ophthalmologists, but also diabetologists, because we are less than 2,500 diabetologists and endocrinologists in France, and also this social aspect like access to jobs and also driving lessons. And we are fighting together with people with diabetes, with health authorities. Priorities, access to European funds for the French Center. We are a little bit selfish in France and we would like to get more money from the European Union. Prevention of type 2 diabetes, like in Italy, screening type 1 and type 2 diabetes, implementation of remote monitoring, cost efficacy analysis with OB2F, access to jobs again. We do have some success stories. I think we are good in exchange among the World Diabetes community that we have twice a year during the board of directors meeting. Every subjects are, on the table, and we summarize and we decide what we need to do. We are better and better by setting up some federative projects, such as Coronado is over. Coronado has been published in Diabetologia several times. The current SFT T1 cohort and also the OB2F cohort. The OB2F is a study aiming at evaluating the cost and efficacy of initiating a closed loop in people in France. Remote monitoring, implementation and reimbursement. I can tell you now that remote monitoring, what we call as telesurveillance, is now reimbursed in France. 3 levels of reimbursement according to the complexity of the patients, and also the close relationship with people with diabetes allowed to lobbying health authority together. I think so. This is my final slides, just to give you an example of what we are doing together. This is a SFT1 cohort study. We have clinical data, we have biobanking, we have questionnaires from people living with diabetes, we have 6GM data, we have connection with the French National Health Data System. I don't know how Jean-Pierre was able to obtain that authorization. But what I wanted to say is that this cohort was built with people with diabetes. And now I am very happy to tell you that more than 2,500 people with type 1 diabetes has been included. So thank you very much for listening, and I will be happy to answer your question.
Good afternoon, and thank you very much for inviting the Romanian Diabetes Forum to participate to this session. So it's a pleasure to be here and to show you a few things about how Romanian Diabetes Forum was established and some of its objectives and actions which are on their way and trying to contribute to this very complex ecosystem which is diabetes prevention and care. And of course I will speak about the connection with the European Diabetes Forum, one of our important goals, because this means good connection with what happens at European level. So as of today, the Romanian Diabetes Forum has 10 medical societies as members, 10 patients associations, 2 professional colleges of doctors and pharmacists, some health authorities, and this diabetes working group of RPIM being the national equivalent of FPIA at European level. And indeed, Romania was among the first European countries to develop a national diabetes forum. From the beginning, the member associations decided to try to identify gaps in what successful diabetes care and prevention is and was in Romania at that moment, because I must say that in terms of access to medication and devices, in Romania, patients with diabetes are 100% covered for all molecules, including insulin, of course, based on national guidelines and prescription guidelines and protocols, as well as for devices such as insulin pumps and CGM. By contrast, there are few critical elements missing, among which diabetes registry and digitalization, and of course the big problem of diabetes prevention, which to be successful, of course, means to raise awareness on diabetes. The first moves, let's say, was the collaboration protocol with the Romanian Society of Diabetes, Nutrition and Metabolic Diseases, which was signed in 2018 and then renewed. And soon after that, the Romanian Federation of Diabetes, Nutrition and Metabolic Diseases joined the efforts of Romanian Diabetes Forum. And I want to mention that this organization, the Romanian Federation, was created in 2001, inspired by International Diabetes Federation. So we already had a model of collaboration between scientific societies, patients association, diabetes educators, and other stakeholders in Romania. And in 2020, a memorandum of cooperation with the 10 Patients Association was also signed. This component of diabetes, Romanian Diabetes Forum, being considered as extremely important and having the benefits of adding new perspectives in what diabetes care and prevention can be. We had some activities with a certain periodicity. We had technical meetings with all members on specific topics. Then annually we had General Assembly meetings, which were able to maintain the cooperation and the communication between such a large number of associations. And we also were very careful to to have a good connection at public level. So the Romanian Diabetes Forum organized conferences such as public events that reunites representatives of all kinds of public institutions, other stakeholders with interest and roles in diabetes care and prevention. And as I mentioned before, we try to establish some common, of course, objectives for all the member associations, and also to tackle the missing elements in what diabetes care and prevention means. One being raising awareness regarding diabetes. The second one, to develop a collaboration framework and a very good communication and agreement with all interested stakeholders, and policy shaping mainly on prevention, but of course not neglecting diabetes care aspects, including the establishment of diabetes registry. As for the key projects organized or tackled up to now, the first steps were to have this collaboration framework that reunited patient association, medical societies, and drug manufacturers. And I also want to mention that this way of working with the pharma companies, with their organization where they have common goals in diabetes care, was a successful way to do this collaboration, to have this collaboration with the pharma industries. Then in 2020, we had the national awareness campaign called You Don't Play, meaning that you don't play with the diabetes risk, which was an online campaign mainly. And one of our important projects, if not the most important project, was the Romanian law regarding prevention and early detection of diabetes, which was signed by the Romanian president in November 2020. The next year, we tried to establish one unique voice regarding access of people with diabetes to health services. And for the last 2 years, we concentrated the activities of the Romanian Diabetes Forum on screening and evaluation projects in partnership with different local public authorities, and involving also the pharmacy network in Romania, and to have more concrete steps for the implementation of the diabetes prevention law, which of course is not the unique project of the Romanian Diabetes Forum. The Romanian Ministry of Health is involved in mainly in the implementation of the law, and the Romanian Parliament was the main actor, let's say, to promote this law for prevention and early detection of diabetes. And a few words about our prevention law. 4 policy directions were established and negotiated between different stakeholders: education, prevention, early diagnosis, and patient care. And all these 4 pillars are included in the prevention and early detection of diabetes law. We also had, as I said, pilot screening projects for diabetes with different partnerships. And why was this important? Of course, the first goal, let's say, was to detect undiagnosed diabetes in Romania, but also in the context of the efforts to start implementing the law, to produce, let's say, best practice cases that for the future can be replicated on a larger scale, because in the prevention law there's a big part, let's say, dedicated to education and prevention activities, which will be done through different stakeholders. So the law will just provide an umbrella for this kind of activities, and of course, hopefully, a part of the financing needed for prevention activities, mainly in terms of educating population and groups at risk for diabetes. And the connection with the European Diabetes Forum was and remains an important focus for us. Here we mentioned a few of the participations of the two organizations. We were very happy that the European Diabetes Forum supported very much the creation and the further steps of the Romanian Diabetes Forum, and the representatives of the Romanian Diabetes Forum participated in different activities and events organized by the European Diabetes Forum. As for, we said, learnings and key takeaways, following our 5 years of experience in working in the Romanian Diabetes Forum, we think that maybe the most important advantage of being organized as a diabetes forum is that we can come with one strong and unique voice, especially when talking with the health authorities. Joint objectives which are accommodated between various stakeholders and member organizations are also important. And we think that, at least from Romania, the fact that we have now a prevention law on the first therapeutic area, in fact, which is diabetes, it's an important accomplishment. The fact that the local authorities became engaged in this fight against diabetes, it's also an important aspect. The contribution to increase the awareness, also important at population level, and the contribution of each member association, but of the Diabetes Forum as a whole, represented, we say, a big step forward, better diabetes care and prevention in Romania, and hopefully can serve as a success example for others as well. Thank you very much.
Good afternoon. I'm happy to present you on behalf of the Belgian Diabetes Federation what we have done since its creation at the end of 2019 and what we already have achieved, although much is work in progress. And I will also stress how we organized our actions, and maybe this can be an inspiration for other countries. Let's start from the beginning. Why did we feel the need to organize a Belgian Diabetes Forum? Well, we felt that our previous, rather voluntary advocacy had reached its limits, that it was difficult to have more progress. In fact, in Belgium, we have a long tradition of the two patient associations negotiating with the government and with national health insurance, with support of several leader clinicians in the two parts of the country, in the Flemish-speaking, Dutch-speaking, and the French-speaking part. And we were quite successful in the top of the pyramid of diabetes, in the treatment of type 1 diabetes and the treatment of far advanced type 2 diabetes, because there we have a system of what we call diabetes conventions, which is in fact contractual healthcare, where we get bundled payment to provide multidisciplinary care for these people, to give them education and to provide them material for treatment and for self-control. And in this top of the pyramid, in these diabetes conventions, we have established advisory platforms. So from time to time, every year, every 1.5 years, we can have a long discussion with the health insurers, with the people of the government about the results we achieve in these diabetes conventions, and then we have an open discussion, in fact, where we can explain our problems. And this gives us the opportunity to change things. And for instance, already 2 years ago, we could manage that every type 1 diabetic patient in Belgium is eligible for hybrid closed loop technology. So we can really achieve things, but in the top of the pyramid. And the problem is that in the last years, we felt that there was no progress in certain other key areas, especially in the bottom of the pyramid for type 2 diabetes, the prevention of diabetes, the early detection of diabetes, the early treatment of type 2 diabetes. And one of the possibilities we encountered is that when we came to the government or the health insurer discussing about organization in primary care, for instance, about prevention and so on, that they no longer want to focus on one disease, but they want to look at NCDs, non-communicable diseases in general. So they always put us off when we came talking about diabetes, and so this became more and more difficult. Another reason why we felt we needed a Belgium Diabetes Forum is that advocacy takes a lot of time and preparation, and that we felt the need for a larger professional approach with a proper budget, with professional guidance, and we thought we could advance more if we organize things in such a way. We started a few months later than Romania, in the end of 2019. Not very fortunate period because it was just before the COVID pandemic. And we started with several funders, as you can see here, funders from the pharma industry and the biotech industry. We had a big endorsement, big collaboration with the two diabetes associations, the Dutch-speaking and the French-speaking Diabetes Association, and with support of several clinician leaders in the two parts of the country. In fact, the same people that also discuss in the discussion platforms of the top of the pyramid. So these are all people that have a track record in negotiating with the government and with the health insurers. We also had operational support by a consultancy firm which is specialized in public affairs and which helps us to organize everything. And our aim is really to bring together as much stakeholders as possible, try to speak with one voice, as already has been said, so align on priorities and urgencies, and really come out with one voice to the government. How did we organize things? The first thing we did is to ask the people of the consultancy to do extensive field work in interviewing as many stakeholders as possible and listing what is going well and what is not going well in diabetes care in Belgium. And I want to stress that it's also important to say what is going well. It's always better to start with a positive point when you discuss with health insurers and with the government, and it's always better to thank them first of what they already have achieved, because we have already achieved quite a lot for diabetes care in Europe, but then of course point to the problems, to what has not been addressed, what should be improved. And we bundled all this in a white paper, so we created a large list of propositions that we distributed widely in political circles. A list which is in fact too long. It's always difficult to work with very long lists, so we chose to, besides that long list, to select 3 ambitious but achievable priorities for the next years, and that we selected in consultation with our stakeholders. And these 3 are closely in line with what the European Diabetes Forum has as priorities, so that's good because then we can join forces. And these 3 priorities are first to design a national diabetes data strategy. We have in Belgium, and this is probably the case in many other European countries, a lot of electronic data, but there's no strategy to integrate them and to use them to improve care and to guide policy. So we really need to improve this and to have a national strategy. Second point is that we want to use digital technologies to empower people. And this is also quite difficult because every citizen in Belgium has access to his electronic medical record, but the data that are presented there are not easily understandable by people. They are not presented in a motivating way. Many people even get very worried if they see what's in their electronic medical files. So we think we need other ways to present this, and we are thinking about colored dashboards to help people to understand their proper electronic medical records. And the third priority is that we not only want to organize care as a true multidisciplinary team effort in the top of the diabetes pyramid, but that we also want this at the bottom of the pyramid in primary care. This has already been said for Italy, that it's difficult to engage primary care in a good multidisciplinary integrated diabetes care. It's not only important to align your priorities a little bit with the European Diabetes Forum, but certainly to align them also with the government policy goals of the Belgian federal and the Belgian regional governments. And the problem is there, and that we try to do this. And the problem is, of course, that we have priorities that are directed to diabetes, and they have priorities that are directed to more general NCDs. And our solution for that is that we always say in all contacts we have that diabetes is really a pioneer disease for other NCDs, that diabetes is a very complicated chronic disease, so if it works for diabetes, it will surely work for other NCDs. And what we also say is that the diabetes field is a very enthusiastic field that is quite well organized, so we are ready to help to deliver quickly. And this is very important for politicians. If you can deliver before the next elections, or even if it's a small thing you can deliver, that is important for them. And so this opens doors and can help you in really achieve what you want. How did we progress? We started to work with these three priorities, and first we created in-depth forums where we had open discussions about our priorities with a lot of experts, and in fact with anyone who was interested to join, where we wanted to deepen, to refine our propositions and to make them much more concrete. And in fact, I must admit that the pandemic helped us there, because we had to organize all this via teleconferencing, and this allowed us to involve much more people in the discussions and much more experts at the same time. And we could also engage people from abroad. So for instance, in our in-depth forums on the diabetes data strategy, we also invited people from the Swedish National Diabetes Registry and from the Scottish Diabetes Dashboard in order to discuss with them. So this opened our mind, and this made what we wanted to achieve much more concrete. What's also important is that in these discussions, from time to time at key moments when we felt ready, we invited also policy makers into these forums so they could see that we could mobilize a lot of people, that we had interesting experts, that we had a connection with abroad, which is quite interesting for these policy makers. And they could also at the same time see that for many topics in Belgian diabetes care that there were better examples in other European countries. So that's also important for policymakers to see that they are lagging behind in certain teams in diabetes care. And then another thing we do is that from time to time we make a lot of noise, a lot of fuss. We organize a big live event. Last year we called it Speak Up 22, where we invited many people, and when approximately 200 participants came to make their voice heard to policymakers with short inspiring lectures, and then breaking up in small sessions to brainstorm on certain topics. And then we end with a panel discussion where we invite policymakers and where we also invite the press, so that this can be really an event that can mobilize a lot of people and that can make a lot of noise. In fact, next week we will have our Speak Up 23, where we want to write together with all the invitees, all the people that want to join, the manifestos of the political parties for the next year's elections. We want to have diabetes in these manifestos, and as you can see here, the guy at the left is our Minister of Health of the federal government that has agreed to come, so let's hope he will, and that we can influence what he will write in his political manifesto for the next year. What did we achieve so far? It's all work in progress, but we achieved quite a few things. On the diabetes data strategy, we had the creation of a health data agency to facilitate the use of existing data. And in fact, this was one of the policy goals of our Minister of Health, but was quite difficult to achieve because there was a lot of there were a lot of people that opposed this, also other agencies from the government that didn't want yet another agency to be created, but we helped the minister to push this through. And in the meantime, the minister accepted that diabetes is the first use case in a project we called Diabetes Living Database, where we want to combine several existing health data in order to be able to answer questions about diabetes care, quality of diabetes care, epidemiology, complications, and so on. And as stressed already, we always say that this is a pilot for other chronic diseases. And then we also have a project that we call Diabetes Barometer to improve the labeling of people with diabetes in GP health records, which is also important because in many databases there's no clear diagnosis of diabetes, so we want to improve the diagnosis from the beginning, from the start of diabetes via this Diabetes Barometer project. Second topic, empower through technology. We did a survey of people with diabetes, a broad survey to inform if they would be interested in a personal diabetes dashboard and which parameters could be in. And the result is that they are overwhelmingly interested and that we already have a lot of ideas and a first draft to make visual parameters about diabetes parameters. And the third topic is a topic on integrated care, where we could convince the health insurers to adapt an existing educational program, which was not a very successful program, into a real multidisciplinary care program for type 2 diabetes that will start at the beginning of 24. So we had quite a lot of achievements, but a lot of work in progress too. This is my last slide to show you the take-home key strategies. Strategy one is that you should involve as many stakeholders as possible and try to speak with one voice, but use the power of the patient associations and also of clinician leaders that have a track record in negotiating with payers and with government. Always start positive and thank for what has already been achieved. That's a good way of starting the discussion. Identify needs through a broad consultation. So the white book we created is important to identify all the needs, all the meanings of these stakeholders. Align your proposals as far as possible with government policy goals, because then you can say this is our proposal and in fact it's the same thing that you want, or the difference is that you want it more broadly for non-communicable diseases, but we can start with diabetes as a good example. Make them feel you are a serious partner. Show your expertise, show that you are well prepared, that you can mobilize a large group, that you are connected with the broad. That always helps. And of course, indicate that you can really mobilize the field of diabetes and that you can use diabetes as a pilot for other NCDs. Thank you for your attention.
Dear Chairman, if you allow me, I will do a little promo, because it takes a bit of time to set up the next slide. So, okay for you? So Frank was alluding to the elections we are preparing in Belgium, and I can actually announce that also within the EUDF forum, all our members actually worked hard the previous weeks and months to come up with a new pledge for the European elections. You cannot see everything, but it's about the 4 E's, which is early detection, equitable care, empowering people, and last but not least also embracing science and technology. So we will translate that in a lot of languages, so in French, Italian, Spanish, Polish, Romanian, Dutch, I probably forget a few languages, German. And so this will be available within the couple of next 1 or 2 weeks. And so I also wanted to warmly invite you. We have a specific dedicated session here at EASD as well in the spotlight stage on Friday, 10:45, for half an hour. And so why I'm telling this to you and why do we have this session? Because we count on all of you as well to contact politicians in your country. Because as you know, the members of European Parliament, they have meetings in Brussels and Strasbourg, but of course they are elected in all of your cities and countries. So I think it's important to not forget that at the end of the day, it's the countries who decide who they send to the European Parliament. And by this, I see the slides are set up, so welcome.
Bart, the pledge will be available in a digital version on EUDF.org.
It is already available, yes.
So in English, but all the other languages will
follow soon.
On the EUDF.org?
Yes.
Excellent.
Well, Chantal and Stefano, thank you very much for the invitation. And I was given the task in 10 minutes to show you what we are doing in Germany regarding best practice examples and diabetes cooperations. So far, we are not yet established EUDF members. I first want to introduce to you what associations we have on professional levels and patient levels and who is involved, then what are the main issues in Germany, and we've heard already quite a bit, therefore I will be quick on this part. I will talk about priorities and goals, and I will have a couple of success stories. Now, the important organizations in Germany dealing with diabetes are the German Diabetes Association, which is a medical, scientific, professional organization with more than 9,000 members. They're not only physicians, but also diabetes educators, psychologists, and other healthcare professions who are involved in diabetes care as members. And I'm presently on the board of the German Diabetes Organization, or DDG. In 2009, the DDG also helped in creating a new diabetes organization, Diabetes.de, or the German Diabetes Aid organization, that now is the patient voice for people with diabetes, and which has the aim to avoid discrimination and to increase diabetes awareness and to lower diabetes incidence by practical diabetes prevention and awareness. The problem is that at the moment only around 40,000 patients with diabetes are actually in patient organizations, and that on this part we need to improve. Now, back to the German Diabetes Association. The mission is to promote research and also support the next generation of professionals. I will show you examples how we do that. Organize diabetes care, strengthen the so-called speaking or non-interventional medicine in hospitals, because in Germany we have a reimbursement system where technical procedures in hospitals are paid better and are economically more attractive than diabetes care. Organize prevention, sensitize politics, and increase diabetes awareness, and of course organize digital transformation. And we've already published a first white paper on digitalization in 2017 that now is renewed, and with that we have a plea for interoperability of all digital help that we have. A very important step also was the German Center for Diabetes Research, also founded in 2009, which has 5 transnational research centers in 5 cities in Germany, and that has the mission to discover and develop innovative and precise strategies for diabetes prevention and treatment and research. And this is funded mainly by the Helmholtz Scientific Society and has also cooperations with universities. One example is cooperations with the University of Munich, for instance, or with the University of Tübingen, where I was working. On the GP level or on the practical outpatient level, there is a large professional association of diabetologists in an outpatient setting, the Berufsverband of niedergelassene diabetologists, and we are closely working together with them, and for a couple of years we have members of the BV&D in our DDG board also. And then there's a professional association of diabetes educators with roughly 2,000 members, and we also have cooperations and regular meetings with them, and we also have joined position statements and papers that we give out for standards in diabetes care. Now, a best practice example regarding diabetes prevention in Germany was in 2010, the joining of 20 organizations, medical associations, as well as other associations to join the German Alliance for Non-Communicable Diseases, or DANK, which means thanks. And DANK has 4 central petitions for diabetes prevention. One is 1 hour physical activity in kindergarten and school daily. Then we promote higher taxes, value-added tax on adipogenic food and soft drinks. An example giving no VAT tax on vegetables and natural products, and higher taxes than the now normal rate on soft drinks and sweets. Compulsory quality standards for meals in kindergarten, and a ban on advertising of unhealthy food and drinks directed at children. And with the last point, we're actually quite successful at the moment with the Green Party being in the government, and hopefully this legislation will pass very soon. The main issues are more or less very similar to the issues in Italy and in other countries. And for patients, this is the discrimination and the wrong view that diabetes is a self-inflicted condition. Then in Germany, there is the negative thing that only few patients are organized in patient organizations, and that therefore patients do not yet have a lobby or a strong voice, and we're trying to change that. Then, because Germany is federally organized like Italy, we have the local differences of access to diabetes care and different playing rules on reimbursement and so forth. And we have a very strong and traditional separation of outpatient and hospital care in Germany, which is not very helpful in the incidence. On the other hand, for the healthcare professionals, this separation is also important and a barrier, and is also a barrier for the possibility for qualification of medical professions. And of course, the German medical system puts more money in acute emergency medical care versus conservative and speaking medicine. and of course, bureaucracy and documentation, which is not very well standardized in Germany, but huge, is also a problem. And we also still have a non-sufficient grade of digitalization in healthcare, like I've heard from Italy and also Belgium, and we have to work on that. So the main goals are implementing a national diabetes strategy and to overcome the traditional sectional diabetes care in outpatient and hospital sectors. And we hope that we are getting on with that also with new plans on how to organize the medical system in Germany that are being made by the government right now. Implementing a valid diabetes registry, and here we see a large chance with digitalization, and we hope that with a standard electronic patient record, we will make progress with that. And regarding diabetes prevention, we have to strengthen conditional prevention over behavioral prevention, and this is actually a political issue outside the medical field in order to change society and in order to make the easier choice, the healthier choice regarding people's preferences. We have success stories, and one of the large success stories is the implementation of the German diabetes research centers with their 5 places. You could see that in the past EASD, where a lot of prizes were actually going to Germany. And success story is also the increased and improved collaboration of the associations and the collaboration between the DDG and the German Diabetes Research Centers and Diabetes.de and DANK. Increased diabetes awareness, novel regulations for people with diabetes regarding occupational discrimination are increasing, and there we have a new guideline regarding driving licenses and rules for special occupational possibilities. Food labeling, here we can have more. So far, the Nutri-Score is only on a voluntary basis and not mandatory yet, and we are making progress on ban on advertising unhealthy food and drinks directed at children. And with that, I close and gave you a short glimpse on Germany and Hamburg, and I'm looking forward to the discussion now. Thank you.
Can we invite here the speakers and our colleagues and friends?
Yes.
Please.
Can I also ask Bart to join? Bart, can you join? You have no choice. Sit. Ah ben voilà. Voilà. No, the reason why I wanted Bart to join also is I imagine people in the audience, you know, now have the question, okay, I come from Spain, I come from Portugal, I come from another country. How do you start such a thing? I mean, the Romanians were the first, but how do you do this? And so perhaps I need to ask Professor Balla first, how did you do it? How did you start?
Yeah, thank you for the question. So the first thing I think is to be convinced that this is a good project that will help in the future with various aspects, let's say of improving diabetes care. Then I'm sure in all countries there are already organizations, medical societies, patient associations used to work together already in some projects. So in this respect, I think that it's not at all difficult to...
But you need, I think, champions like you. You need somebody to take up the phone and say, Come on, let's sit around the table.
Yeah, that's true. Somebody who is already recognized or used to do this kind of work. In Romania, it wasn't difficult at all. And another thing is that we didn't start with a structure, a pyramid, directors, vice presidents, etc. So for now, everybody is equal. We have an external agency doing this work of organizing, facilitating communication, taking care of projects. And then every organization has this feeling that their contribution is really important, taken into account every time somebody comes with a project.
Excellent. And Bart, I mean, it's the same story in different countries. You need champions, people to say, let's do this. I hear facilitation is needed. I heard it from Frank. I know it from the Belgian Diabetes Forum. We have made a white paper to help, you know, a scenario. Can you discuss on that? Because it's on our website.
Yeah, we have done a few things. We have made a case from Romania. You helped with that. We made a case for Belgium, where we basically did not go into the content that you have seen today, but just more on the process, on what are the steps you can do, and real life steps we did in Belgium and Romania. And indeed, beyond that, we just wrote very practical steps you can take. It's about governance, but as you said, maybe not too much about nominations, but still about thinking who to include from the very beginning, and then have, I would say, a lot of very open conversations. But indeed, this is on our website. We have like a sort of guidance. It's only 1 or 2 pages, and yeah, and being respectful for all partners. I think that's also what we try to do at EUDF, to mention all the partners, to appreciate the contributions, and I think that's crucial. That you used the word, we are all equal. I think that should be the spirit, that we call each other with maybe the name and not so much with the titles.
Yeah, and if I can, because what you're referring to is a sort of, here, I think they can hear me, it's a sort of a think tank. And I know that the idea of the think tank is very much used by my friend Agostino. You know, would you, Agostino, just tell me a bit more, you know, how did you manage to bring in so many components and without really raising the susceptibility of anyone?
Well, that's exactly the key. The point is that too many times you have different organizations, both scientific organization or citizen organization or patient organization, who play more for themselves than for the common good. If it weren't so, we would not have in Italy 3 or 4 patient organizations, and they are all patients with the same disease. So what you need to do, I guess, is to transform this into a platform of thought, or think tank, or whatever you want to call it, where you say, look, I am not here to tell you what to do. I'm here to collect ideas. And we need to collect ideas because our politicians, those who make the decision, are not all the times, actually, seldom times, are really aware of what's needed and what would be the most practical way to achieve this. Now, it can be a right-wing, a leftist, a progressive. I believe, that's my personal opinion, that as a scientist, you need to be liberal and progressive. But anyway, diabetes is a transversal issue. The law on the screening for diabetes was voted unanimously in the Italian parliament, and not many laws are voted unanimously. So you have just to go out there and say, look, I'm here to collect ideas. You do need some sort of structure. You need somebody who does the dirty job, who coordinates the thing. But the key is to try to get the inputs, try to facilitate, for instance, acquisition of data. This is a very crucial issue. Everybody's mentioned it. And then suggest the politician how to translate them into practice. Another thing is that the politicians need to be involved from the beginning. That's why we have, among our partners, the Parliamentary Group on Obesity, group on diabetes, group on health in the city. We have the township societies and so on. Because if they start to be involved by the beginning, from the beginning, then they are more apt to understand what is at stake and to act upon the suggestion.
Can I just also tell the audience, you can also ask questions.
Or if there is any...
There's
any
microphones, but we're not... Well, we are quite a few, but we have a big room. Xavier, I go here.
You can come here, you know. No, come.
Congratulations. I think it's what you have just been said. This thing is, I fully agree. The important thing here is to identify which one are going to be the critical factors to succeed. Because normally, if we don't pay attention that in our strategy, we are going to fail. It's important an analysis country per country, which one are the specific aspects that probably we have to address. Because in Europe we have different healthcare systems. We are managing in some ones primary care is robust, some ones is not, some ones we have powerful patients associations. So I think we have to create alliances and then in that exercise at the beginning to identify what are the critical success factors and then to implement, to design actions that are going to target that aspects. And then move first for feasible aspects that will be also motivating those in that kind of a strategy that makes that we are doing an effort and it have sense. But when I saw the slides and I pay attention, many of these is related to regulations. In many countries, there are some regulations that requires to be changed. So politics must be also involved here in that journey. And politicals just sometimes move because it's the society pushing. Okay, it's the patients and the society, the citizens are pushing and they are demanding that something must be changed. And I think we have to incorporate for sure persons living with a chronic disease and also other citizens committed with the idea that we have to push the politicians to change the agenda. If not, it's going to be very complex.
But Xavier, I think that you raise an important point, you know. I mean, we started the EUDF. The EUDF is, you know very well because we're part of that, you know, it's a new European organization, but there is a lot of differences across Europe and we needed to have the collaboration of the local organization to really address which could be the main issues in the country and inform the other countries because, you know, out of that experience we can really build up even stronger advocacy process.
If I may, yes, I totally agree with what has been said just previously because the specificity between countries, as you said, is very, very important. But for us, I think what was very important was the alliance between the health professionals and people with diabetes because our health authorities, they are talking first with the patients, with people with diabetes, and then afterwards they talk to us. So I think we gain time by doing directly at the beginning to be very close together.
I think I heard in many of your stories data as a priority. And, you know, it's to drop dead that in most of our countries, actually, we don't know how many people with diabetes there are. I mean, the whole IDF Atlas, with all due respect, but I mean, how do we decide how many people there are? And can you believe our politicians need to organize healthcare without knowing to how many people they cater? So, Frank, can you go back to you know, all the strategies in Belgium that are now on the table? How we want to do this?
Oh, this is very complicated, Chantal. Problem is, I think, in every European country you have really a lot of databases, databases that are not interconnected very often, databases that have to do with nomenclature, what has been done in the clinics, but also databases that have been included on quality, where we measure certain parts of the diabetes care and look at quality. These are mostly things that come from bottom up, but all these databases that don't talk with each other, And what's also a problem is that in many databases, the diagnosis of diabetes is not quite strict. So you really don't know very well if this person has really diabetes or not, or is just taking metformin because it's an obese person, for instance, with the SGLT2 inhibitors and GLP-1 receptor agonists. It becomes even more difficult that they are used in other people. So that's what we try to do. So one of our things now is that we will use diabetes as a use case, trying to answer several questions about how frequent are the different types of diabetes, what are the complications, what's the quality of care, what is the cost, and then look, with the help of the Health Data Agency watching, in fact, where we get problems, because we will have many problems trying to connect data, trying to look at privacy problems, which has already been said. So we have now an official health data agency. That's very important. So if we try, and the goal of that agency is to connect databases. So if we can show them how difficult it is to connect all these databases and what issues we encounter, then we hope this might improve and finally end into a national diabetes data strategy, and more broader, a national NCD data strategy. Let's hope. That's dreaming.
The microphone is difficult to see because of the lights.
It's the godfather of the whole idea. It's Rob Heijnen.
So thank you so much, Chantal and Frank. First of all, really my admiration and respect for all the work done by the individual ambassadors. And this really leads to my question for all of us. Do we take diabetes seriously enough? And for me, it's a very serious question, because the discussion we have today, we had also at the St. Vincent Declaration 30 years back. The same themes are coming back. And the reason I'm asking the question, do we take diabetes seriously enough? Can we leave it to individuals in major countries to solve the issue? With the EUDF, I was privileged enough to work together with an international group on the strategic forum on registries. And we really tried to develop this registry document as an implementation document. So we highlighted all the potential barriers and how to deal with them. And another question is, has this document been helpful in any of the countries? Because I only heard from Belgium the need to develop registries. And I think we were extremely clear that registries are needed, to Chantal's point, to generate the data that can convince the politicians, the healthcare people to take action. And my last question to all of you is, do you need help from the EUDF or from whatever institution to help you implement the things you think are needed in your countries? Because I feel almost embarrassed to leave it to individuals to organize everything in major countries. I don't think it will work. To be very, so the likelihood of being very successful at the end is very little if we are not providing the support that's needed to really take care of a very serious disease called diabetes.
Yeah, so it's the dilemma between being top-down with a beast like EUDF say, this is what you should do, and then having initiatives bottom-up come up from the individual countries with the context of all the, the sensitivities that you have in a specific country with 30 different patient organizations and with all the different healthcare organizations. So, yeah, I think until now we have, as EUDF, tried to be catalysts, but thought because of the different sensitivities, the different structures, leave it to the different countries. Rob is saying this is not going fast enough, this is not going in depth enough. So how can EUDF support further? How can we be a better catalyst to make this thing move forward? You are the latest forum started. So how did it start with you? Was it because there is an EUDF, or how did you start?
If I have to be totally honest, good portion of this was having Stefano, president of EUDF. Having said that, he's very right. I think that the EUDF National Forum needs to be like transmission belt of the EUDF initiative toward the different countries. You cannot have a sovereign national entity being able to define which would be the best pathway for each single country. But we do need to start from some point. That's exactly what we try to do, taking the major activities and projectuality that EUDF was laying in front of us and trying to see, and we are in the process of doing this, how this could be adapted to our own country and how this could be developed in the country. So I guess that doing what it's doing on the EUDF part with the tremendous help of Bart, Stefano, and next from you, your part, and all people working together will be instrumental and fundamental for the activity of the countries. And having this supranational partnership is also going to be very useful in trying to put together different sensibility inside every single country.
Push and pull.
Exactly.
Yeah.
Exactly.
Frank?
Well, I think Europe should make a lot of noise to endorse on us, to show really that we need this. Because I've just had the same as Rob, a lot of gray hair, so we were already into negotiating at the moment of the St. Vincent Declaration. And when we had that declaration, we got much further in Belgium because we had that European umbrella that was saying push through and change things. And this is important because all these politicians have European contacts, and if they see that certain countries are going faster at certain points, that's important. So altogether, I think, and Europe and top down and bottom up.
Cornelia,
you
also said that that it's, it cannot be overestimated how important it is to have also this European voice behind everything. Was it important for you also in Romania to say Europe is watching, Europe is also doing this?
Yes, of course it was, because first it was this idea to create such organizations. So it was an inspiration. Maybe it could have come to us spontaneously, let's do a diabetes forum, maybe not. So it was important to have this model. And when the model comes for a higher level, superior level, such as European level, of course it is useful. But then it is important, how do you perceive that? And I wanted to mention that one of the main advantages, I think, to have diabetes forums in different countries is that negotiations are behind closed doors. If, of course, they are honest, inclusive for everybody. And then when you come publicly in front of authorities or in front of your citizens, let's say, that's an idea which was hardly negotiated before, but now it is, one voice.
Okay.
That means one voice, in fact, not somebody saying, you have to do as I think.
Yeah, I mean, going with split voices to politicians gives them an excuse not to do anything. So, yeah, indeed. I am a very bad chair, so I should have, I know I go to you, but so Professor Xavier Cos, PCD and Primary Care Spain, Dr. Rob Heijnen, Eli Lilly. Please introduce yourself.
Yes, good afternoon. It's Dipesh Patel from London, the UK. So I feel instantly like a naughty cousin. We are geographically in Europe, but not quite in the EU. My question is, it's great to hear the ambassadors of individual nations. We are all stronger together. We're hearing great, ideas of best practice. We're all in this course together. But it's a lot about policy, and policy means politicians. Certainly in the UK, we've been promoting politicians, champions, like we have clinical champions, healthcare professional champions. What mechanism does the EUDF have to actually support political champions to communicate with one another to help compare policies across Europe?
Bart? The members of parliament?
There is indeed, under the leadership of IDF Europe, members of parliament. It's called MIPS, Mobilizing for Diabetes. So MMD, they have also a dedicated website. So in this forum, and we actually, all the other members of EUDF try to recruit additional MEPs. That's also why I highlight the importance of the upcoming elections, to make sure that this group, which is now about, I see Elizabeth in the room, I think there are now about 20 members, but of course we always need more and more countries involved. So that is a very concrete aspect, and I think at all the events we organize, but also our members or supporting collaborators organize, we try to involve new MEPs as well, and to make sure that they are aware of this group, and hopefully we can grow it further. So I think that's a very practical aspect. I know it's also existing in Italy, where they, because again, it's always both at national but also European level. And yeah, I think that's the main way.
Yeah, thank you. I really think that, yes, political leadership and as you say, sharing best practice, getting politicians to speak to one another, they'll be stronger together to essentially, portray our voices. So thank you.
But I think first of all, they need to be, alerted on what is and I think that is why we are trying to establish a network with, let's say, a sort of a coordinating activity through the European Diabetes Forum, but also having all the local region to really work to try to sensitize the local politicians. It has to be a concerted effort. It cannot be just something that is sitting in Brussels or just, that's why we are really trying to get as many as possible of the national association to get all together in the nation to really expand what is the message.
Yeah, we have the same in London. We have members of parliament who are activists who have have loved ones with diabetes. They have diabetes themselves. They don't have a voice because they don't have a forum.
Yeah.
To speak to one another.
And if you think, this also would open up some channel of communication between the member parliament in Brussels and those that are, in the Senate or the law chamber or whatever, in the individual countries. So it is another way of communication that we need to establish, because sometimes we have to say, the European community has come up, you remember, the intervention in terms of the prevention. There is already a declaration about the registries, but we need all these things to really be funneled down to the local needs.
Yeah, no, this sounds great, but lots of work to do.
Frank?
I just want to add something. A big advantage of multi-stakeholder lobbying is that you have multiple networks you can use. If you try to lobby with a little group, you have your own networks. But if you expand your group, you can really open up networks, and that's what we did in Belgium. We tried to find ways how to influence the Minister of Health in that data strategy, and we found several ways in the different networks of the people that were involved. So once you involve a large multi-stakeholder group, you get that phenomenon.
Several groups also, try to be very inclusive, people living with the disease, primary care docs, nurses, specialists, etc. I know that in the Belgian Diabetes Forum, we also involve industry, both pharma, tech industry. So can I ask how you see the role of industry as a valuable stakeholder in all of this? Jean-François or Baptiste?
Baptiste.
Yeah, it's on. Yeah.
It's working, yeah. I think we need industry on board from the beginning, because industry has the capability to put scientific findings into practice. And that's what we need for the people with diabetes or for the patients. And I think we need industry also looking at the example how things have been running in the past regarding digital devices that were not from the very beginning interoperable and compatible with each other, and we need standards.
Yeah, I think it's a nasty question because, for example, in France, having a link with drug companies is very badly perceived by, I mean, the society, public, at every level of everything. So, I mean, we do have some good connections, some very good partners, but it's only through the area of research, through the foundation or through the SFD directly, we can get some money. But it's very, I mean, I don't know why, it's, but I can, I mean, confess that I won't go to see the health authorities with private partners, because they will say, "Ooh, you are, you know, sleeping with drug industry," and it's so. I mean, probably it's a specificity of France, but it's a very sensitive problem.
It is very sensitive, and I believe we are at a crossroads where we need to discuss openly, candidly, how our relationship with industry is. And in Belgium, Frank can discuss, we took a different path, like we also took it in EUDF, namely to have industry in the open around the table. And also, you know, bring them to talk about their responsibility and their responsibility in solving the whole puzzle of diabetes, not just supporting research, giving money, etc., but also thinking how we can organize diabetes care. And once you do that, the whole dialogue changes, of course. So, Frank, perhaps you can discuss further.
We thought that involving industry would close doors with the government, but you can explain. What we really did is to explain them, to say if we really want professional advocacy, we need funders. We can't do this on our own, so we need connections with industry. And in fact, if you think about it, we have a lot of common goals, industry and clinicians and researchers. We all want diabetes to be discovered early, to diabetes be treated well, that people with diabetes get good education about their disease, that we have data about diabetes. We have many common goals, so if you explain this, and if you avoid a little bit, what we never will do is to ask for reimbursement, for instance, for certain medications. So you look at more broad subjects where you can really get the noses into the same direction. And I think it's possible if you explain this very well.
Silvia.
I totally agree with you, Chantal. I mean, diabetes is an old disease, it's particularly a chronic disease. It's part of an ecosystem. And this ecosystem sees together the people, the decision, the payers, whoever builds instruments or drugs for the disease. So you cannot look at this contest without having in a very transparent, very objective, very open dialogue who is part of the system. And the system is not going to work if you don't consider all the different implications. And this is why I believe it is necessary, if you have a think tank, to have the contribution, whoever has a vested interest in the tank, to say what they are thinking and to contribute to the discussion. And of course, it is your job to separate what's economical interest, what is interest of the common good, what is going to work for everybody. But this can only be achieved if you participate openly in a table and you take out the prejudice. You're not going to go to the agency in Italy, for instance, and say, oh, you need to reimburse this medicine for everybody because we are close to X and Epsilon manufacturer. But you have to try to understand the reason of everybody, to establish a plan, the system which is sustainable from all point of views.
Yeah.
Silvia.
Yeah. Introduce yourself.
I'm Sylvia Lyon. I am helping EUDF by representing from time to time SFD and sometimes ESPAD as well, but mainly SFD. My background before retiring was in the industry. I just would like to say that there are 2 points. One is to think a bit outside of the box, because we shouldn't forget that the EU was built on economical basis. And industry is not only the people we are working, it's bringing employment, it's bringing economical income in the different countries that where they are implemented. And this is something very important for our politicians. When we see our respective government even, they are speaking to the big companies, whether they are from the national origin or not. And we shouldn't forget that. So we would not say to our president, I'm French, Macron recently received all the big companies that someone bought his element. So I think we need to probably make a different approach when we are going. The other point is that the industry, whether it is technology or the medications, have trade organization. And this is a easier way to approach the politician, is not to go straight through one company, but to go through the trade association of the industry. And this is where with like EUDF, we have FPI and MedTech. This exists in each single country. And this is probably where, with EUDF help, we can go in an easier way.
Yeah, and also I think, that sometimes it's not that good to have different tables. So where, you speak with the politician or the administrator as a representative of the people, with an interest in diabetes, and then there's another table where the industry speaks about the same thing. We're talking about the same issues. And maybe it's better to be transparent from the beginning and to know, there are different stakeholders. And anyone has a specific role in that discussion. So it's better, to really lay down all the different expectations, and there are legitimate expectations from the industry that need to be probably mitigated by what is the current economy, the situation, what is the general plan, and so on. But it's better to have just probably one table than multiple tables. I'm Italian, and divide et impera, separate and rule, it's a very, very old way to go.
Frank, did you have a final comment? Okay.
Can I add something?
Yes, absolutely, Jean-François.
I am convinced.
No, but we know that you were convinced. It's also a general discussion.
Yes, and again, being very open. And what we also learned is, even at the European level, I thought if EASD knocks on the door of a politician, they would open. I've learned that when EUDF knocks on the door of a politician, then they open. Because they know it's and the scientific societies and the people living with and. And so really, harmony of voices is...
But yet, on a strategic point of view, Chantal, Frank, you mentioned that, you have your Speak Out 2023 coming up soon, and you are expecting the Ministry of Health to be with you. How did you get him, involved? How did you get him attracted in? So again, because that could be something that could be helpful for everybody. Is there any specific strategy? What has been your strategy? And also, I'd like to ask the same thing to you, because you also, have been saying that you have a regular meeting with them. So what's your strategy? If they...
We just contacted him, we recontacted him, we recontacted him.
So
we just kept
he got fed up.
But they also see we exist now for a few years, is that we are a serious group that really wants to go further with chronic diseases. So we build that confidence.
I think you're too humble now.
And let's hope that he comes, but because last year he also promised and he didn't come.
But that's not,
but also you need to be clever. There's many things in diabetes. We identified, all of us, the importance of data. We identified, all of us, the importance of integrated care. All of us, the importance of digitalization, using new tools to bring in the person with diabetes to improve care, etc., etc. our minister, we knew he was interested in data. So we said, okay, we go for data. So, you know, play on their agenda. I'm sure you know what the pet topics of your Minister of Health are. And so you can wriggle in something that has to do with diabetes. And so if he can say, oh, you know, I mean, this health data agency, there was a lot of opposition. He couldn't get it realized. And then we said, can we make diabetes the case? Can we help you? So it was actually the way you played the whole data thing and just gave him a ready-made dossier to realize his dream. And so that's why he's coming probably, or he will send his cabinet chief or whatever.
How did you succeed?
First, I think that we should acknowledge the fact that health authorities, including ministers of health, since few years at least recognize diabetes as a true problem. So they became interested in trying to solve this problem due to, of course, mainly its high costs for healthcare systems. So they are in fact more interested than before. And this was probably the result of many efforts from different societies over years to put diabetes on the agenda. So this would be a first advantage, that politicians are more and more interested in solving diabetes problems. And then again, the fact that they know, as you mentioned, that behind the Diabetes Forum are also patients association. I think that this is the main advantage, and that patient associations plus all other organizations come with a unique voice solutions, so they don't expect a lot of noise around the problem because they trust, I think, already our capabilities to come with such a unique voice.
And Agostino, EUDF Italia has been also endorsed by the Ministry of Health. Do you have any comment on that?
As a matter of fact, we were received by the Ministry of Health 4 weeks ago, before the event we had on September 19, where the minister could not come but sent a personal message of endorsement, which is very good. Now, we had the fortune of having a colleague as the present Minister of Health. He's a physician. He was the former rector of the University Tor Vergata in Rome. So we have personal contact with him. We also have an extraordinary executive director, Dr. Serra, who has been working for ages on trying to understand how to get the soft spot of the politician, to do exactly what you were doing before, trying what would be of interest for the particular politician, and open the way, pave the way for diabetes awareness. Now, one of the smartest things I think we did as CDIMD was having a diabetes screening into the parliament, into the House of Chamber, into the Senate. So all the politicians, the parliamentary people, being there at the time, were getting either a questionnaire or a finger stick or both of them, and were talked about what diabetes is, the danger, and so on. And I think this is a very strong way of convincing them of the problem.
Chantal? Oh.
Rob is there again.
I'm here again. Yes.
Why don't you come to the light, please? Rather than stay on the dark side of the
I don't need a limelight. No, I'm happy here. So, what I sense from the discussion, which is an important one, that we are relying on chances and being a bit haphazardly. So the question I have, or the two questions I have, is what can we learn from more aggressive societies like the cardiologist and the oncologist? They have been more successful in communicating the seriousness of the disease they treat to politicians, and they have been successful in registries. The oncologists, I think they have already 30 or 40 years registries, the ORTC. So what can we learn from them? And my final question is, would it be helpful for the EUDF to develop an implementation strategy document that can be used as a guidance document for the countries on how to approach their own healthcare systems.
Yeah, and again, I mean, I get your impatience, yes. And I think we're all impatient.
Yeah.
But yeah, I mean, we are not cancer, and I know that you stomp your feet.
And we are not heart attack.
Yeah, voila. But we get it. But this is how we need to progress. And if you look back at where we were 5 years ago and now in many of these countries, we have made progress. Yeah. And so what Bart said in the beginning, there is this guidance document on how you should do it in your local country, what the different, you were participating in the different white papers of the strategic fora. Yeah. So, yeah, we are less aggressive than cardiologists and the oncologists, but, you know, that's perhaps how we get to Rome. So,
but Robert, if I can add, I mean, I think that we have a major barrier that we need to try to overcome all together once again. Yeah. I mean, sometimes I think, you know, that diabetes becomes a disease only when you get an heart attack. That's the point. And that's why the cardiologist can be more successful. Now what we need to establish is that diabetes can reduce the number of heart attacks if we do treat properly diabetes. Yeah. In other words, we need to establish diabetes as a disease. We had this conversation already on other occasions. But I still believe that in the mind, in the back of the mind of many politicians, or the system, not just the individual politician, but just in the system, the political system, diabetes is a self-inflicted condition, particularly when you come to type 2 diabetes. Yeah. And in fact, you can appreciate the distinction in the terms of the approach, the political approach toward type 1 diabetes and type 2 diabetes. So that is what I think we need really to win and to really to try to break down, yeah, and to disrupt. And that's why we need to work all together.
No, I don't disagree at all, but my impatience is the result of having the same discussion for now more than 30 years. And I really want to see some progress being made. It's also self-reflection here. I'm not blaming anyone, I'm just reflecting on the situation. We haven't made progress enough over the 30 years. And of course I feel impatient, but also energized. So let's try to think indeed out of the box, find a different way on how to create a message that resonates.
Yeah, and
doing the same is not going to help.
We're at time, and the next session will start soon, so we need to wrap up. But I am the eternal optimist, and to me the glass is half full. I don't agree that we didn't move one step since 30 years ago. We did move forward. And just the fact that we have at conferences like this one, people with diabetes talking about stigma, one of the previous sessions in this room, you know, what we are realizing with the EUDF and with all of the different countries now also starting forums, collaborating between researchers, clinicians, primary care, secondary care, people with diabetes industry, I think it's a different world out there, Rob. And getting politicians on board, like in many of these countries, is key. And I think we got the difference from 30 years ago now. It's speaking with harmony of voices and getting everybody together, you know, fighting in the dark room and then coming out and saying, okay, we can at least agree on these 3 priorities and that's what we go for. So I think different ways, Romania, France, Germany, Italy, different ways. I heard keywords like champions. I heard keywords like facilitating entities. Everybody in the think tank, everybody in the forum, everybody in the platform. I heard harmony of voices and get the politicians also at the table very early on and perhaps be clever and push the many, many, many priorities that we have in diabetes. Pick the one that you think this is the one we can realize first in our country. And so I will end here. I will end by congratulating all of the national fora and initiatives starting by, you know, you're doing an amazing job, so continue. Bart and Stefano will push forward the European Diabetes Forum, try and, you know, get the fire going in Portugal, in Greece, in the Netherlands, in all of the other countries, to also get the same level of forums, all stakeholders around the table going to change the fate of diabetes in wider Europe. So Bart, EUDF.org is the website to find the pledge for the European elections, now in English, soon in different languages. And another appointment is on Friday at the spotlight stage for another discussion by EUDF. So thank you all for participating and thank you for attending. Bye-bye.